Hello, my name is Nur Ainati Mahmud, and today I'm going to present an article review about exercise and pregnancy. So, for introduction, we have been reviewed 5 articles, which first article is about physical activity and exercise during pregnancy and the postpartum period. On the first article, authors stated that physical inactivity is the fourth leading risk factor for early mortality worldwide, and in pregnancy, physical inactivity and excessive weight gain have been recognized as independent risk factors for maternal obesity and related pregnancy complications, including gestational diabetes mellitus. So for the second article, the effects of home-based stabilization exercise focusing on the pelvic floor on postnatal distress, urinary incontinence, and low back pain. In this article, low back pain is prevalent in pregnant women, especially during the final stages, and pregnant women also often experience stress urinary incontinence, specifically during the third trimester of pregnancy. Third article also stated about low back pain and pelvic girdle pain. This pain is usually affect the pregnant woman around the 17 and 19 weeks of gestation, reaching its peak between 24 and 36 weeks of gestation. The majority of pregnant women receive little or even no care of lumbar pelvic pain. The next article, the fourth article, is about benefits of exercise during pregnancy. So this is basically the general outcome, the benefit of exercise. So in this article, since the 2002 publication of the American College of Obstetrics and Gynecologists guidelines, multiple researchers have reported that benefits of exercise in a variety of formats for the mother, fetus, and child. And for last article is a study to compare the effects of 3 types of exercise program for pelvic girdle pain during pregnancy. So pelvic girdle pain that is often underestimated, but it is common in pregnant and postpartum women. The prevalence of pelvic girdle pain is reported as 63% at the 30th gestation week and 31% at 3 months postpartum and 3% at 1 year after delivery. So that's all.
Assalamualaikum and hi to Mr. Mohan and my fellow friends. My name is Fa Nurhanisa binti Mia Anwar, and I will continue the presentation with the method. For the first article, this article is an expert opinion article, so there are no explanation on the method that they use. For our next article, 80 pregnant women were randomly assigned to control an intervention group, and then in the intervention group, women participate in a 12-week home-based program, and then the control group did not receive any intervention. And then for the article number 3, there are 126 pregnant women with pregnancy-related low back pain, aged between 20 to 35 years old, and then they use numerical rating scale pain and modified Oswestry Disability Index. For the procedure, the control group involved 42 clients, and then the belt group involved 42 clients that wore a lumbo-pelvic belt, and then the exercise group performed a 3-step pelvic strengthening exercise with 42 clients. For the first article, the author conducted a search by using PubMed, MBES, and Scopus program to identify studies with clinical relevance regarding the effect of exercise during pregnancy. And then they use only original studies and systemic reviews for their review. And then this publication will then group based on the topic, include the effects of exercise on the maternal, fetal, and infant health, maternal psychological well-being, and weight management. For article number 5, this article used 45 participants, pregnant women, and then they use visual analog scale, Oswestry's Disability Index questionnaire. And then for the procedure, the subject were allocated in 3 groups. Group A received stabilizing exercise only. Group B received stabilizing exercise and back care. And Group C received stabilizing exercise and abdominal exercise. That's all from me. Thank you.
Hi, my name is Kelina and I'll be presenting about the results. The first article stated that in their result, that exercise among pregnant women was higher incidence of vaginal delivery and lower incidence of excessive gestational weight gain, gestational diabetes mellitus, gestational hypertensive disorders, preterm birth, cesarean birth, lower birth weight was founded in their results. In the second article, between the group analysis, intervention group had significant improvement in pelvic floor muscle strength, transverse abdominis, muscle strength, oswestry disability index, and low back pain after the intervention compared with the control group. And after adjustment for difference in baseline values, the intergroup difference of post-intervention results remained significant. The outcomes were also subjected to intention to treat analysis with a multiple imputation approach, and the results were consistent with the non-intention to treat results. The third article, whereas, stated that the change in the pain score in control group, which is from baseline 3 weeks and 6 weeks, evaluations was insignificant, but the decrease of pain score in the exercise group and belt group from baseline to 3 weeks and 6 weeks evaluations were significant. The fourth article stated in the result that aerobic exercise, progressive resistive strengthening, stretching exercise, yoga, and Qi have been reported safe to perform during pregnancy. And this length of participation in these exercises were from 12 weeks to span of an entire pregnancy. And the frequency and duration was from 3 to 5 times per week within 15 to 150 minutes per session. And they also stated that progressive resistive strength training often combined with aerobic exercises. In this fifth article, they mentioned in their result that a significant difference was shown between the pre-test and post-test values of visual analog scale, VAS scale, score scale, and oswestry disability index questionnaire with these three different groups. There were significant improvement in group C, which is a stabilizing exercise which include pelvic tilt and Kegels exercise, and also abdominal exercise, when compared to group A and group B, which is just stabilizing exercise, pelvic tilt and Kegels exercise, and group B, stabilizing exercise, pelvic tilt and Kegels exercise, and also with back hair. So there were significant difference were found between group C, B, and A.
Assalamualaikum and very good evening. Okay, I will continue my presentation with a conclusion. My name is Mira Fauzi Ashiki Mizur Rasulin. Okay, as a conclusion, being physically active during pregnancy offers women many health benefits such as a psychological relief, better aerobic fitness, and a lower risk of pregnancy-related ailment. Physical activity during pregnancy is safe, and pregnant women should be encouraged to continue or commence safe physical activity. For instance, Agustina et al. 2020 stated that stabilizing exercise with abdominal exercise shows a greater benefit in reducing the pelvic girdle pain and improve the quality of life among pregnancy women. Last but not least, pregnant women can do stabilizing exercise with abdominal exercise such as pelvic tilt, Kegel exercise, and pelvic floor exercise.
My name is Fatin Azza binti Samuddin, so I'm going to present their recommendation. Okay, for the first article, the effect of lumbar pelvic belt versus pelvic strengthening exercise on the level of pregnancy. The recommendation is the use of the pelvic support belt is recommended during pregnancy, and the future research that evaluate the effect of using different types of pelvic support belts and different exercise regimens are suggested. And a longer follow-up period is also recommended in future research. For the second article, physical activity and exercise during pregnancy and the postpartum period, the recommendations are a true clinical evaluation before recommend exercise, physical activity with minimal risk, and women should be encouraged to engage with aerobic exercise before, during, and after pregnancy. And the additional research are needed to study the effects of exercise on specific conditions. For the third article, a study to compare the effects of three types of exercise program for pelvic girdle pain during pregnancy. There is no recommendation needed. For the fourth article, the benefits of exercise during pregnancy. The recommendations are reported methods to improve the process of educating women and to increase their receptivity to exercise, include using an educational video. And second is provide greater support across the pregnancy to facilitate exercise and provide a pedometer or other form of activity. And for the last article, the effects of home-based stabilization exercise focusing on the pelvic floor on postnatal stress urinary incontinence and low back pain, a randomized control trial. The recommendation is but the studies really need a high cost. That's all from me. Thank you.
Next, I'm going to talk about the limitation. From the 5 articles that we have reviewed, only 2 articles stated their limitation in providing or conducting their study. The first article, which is the effect of a lumbar-pelvic belt versus a pelvic strengthening exercise on the level of pregnancy-related low back pain. In this study, the researchers have stated their limitation, which is implementing the intervention during limited gestation weeks may miss evaluation of its influence on the entire pregnancy or even during postpartum. However, despite the limitations stated, the findings precision is not affected. And another article that stated the limitation is the article the effect of home-based stabilization exercise focusing on the pelvic floor on postnatal stress, urinary incontinence, and low back pain, a randomized control trial. In this article, they stated that the strength and endurance of the pelvic floor muscle were not measured instrumentally by electromyography or peneometer. That is their limitation. And for the rest 3 article, which is a study to compare the effect of 3 types of exercise program for pelvic girdle pain during pregnancy, the article physical activity and exercise during pregnancy and the postpartum period, and the benefit of exercise during pregnancy. All these 3 articles has not stated any limitation they face when writing or conducting the study. And this is our reference. So that's it. Thank you.